Hi, everyone. My name is Dr. Jem Martin, and I am an optometrist at the NECO Center for Eye Care at Perkins School for the Blind, located in Boston, Massachusetts. I'm happy to talk today a little bit about the pathway to diagnosis of cerebral cortical visual impairment, or CVI. Briefly, cerebral visual impairment is a brain-based visual impairment, meaning that the anterior segment and pieces of the optical system are well and intact. However, we find that the processing that the patients do with the visual information that they get can be a little bit different. CVI can be caused by many different conditions, including hypoxic ischemic encephalopathy, meningitis, cerebral malformation, or really any condition that introduces injury to the brain. Risk factors include cerebral palsy, epilepsy, those born prematurity, as well as, again, those with injury on brain imaging. For diagnosis, it's important to have care with an optometrist or ophthalmologist that's familiar with CVI. And oftentimes we'll do many different types of assessments, the main one being our comprehensive eye assessment. And this is our typical eye examination where we gather visual measures, look at the need for glasses, as well as look at the health of the outside and inside of the eye. It's important that we have these measures so that way we can ensure that the visual difficulties that these patients are having are more related to the diagnosis of CVI rather than another condition that they may have on their ocular system. Providers will also do functional eye examinations, and this is really looking at how is the patient using their vision. During this time, we're often thinking about the measures that we got and are trying to see if the way that they're using their vision in the real world is matching what those measures look like. Those who see 20/20 generally should be able to see a very large image without having difficulty. There's many different activities that we can do to look at how functional vision is done. This can be done through the use of puzzles, looking at different types of books, stacking blocks, or even sorting images. Whenever we think about CVI, I often think about it in different areas, including this visual attention or fixation, as well as breaking it down to our ventral stream or our what or identification processing, as well as our dorsal stream or where spatial location processing. Whenever we think of visual attention, we're of course thinking of the ability to attend to and maintain visual attention on an object. Oftentimes in the examination, I'm looking to see how they're doing with fixating on an object or even being aware that an object's being presented to them. I might also see if their visual awareness is dependent on other things, such as their other senses and using auditory or tactile approaches, or if a component of light or movement is needed for visual attention to be sustained. I'll also look and see what the delay is in kind of responding to objects that are presented to the patient. Visual memory is the ability to have seen an object or person and recall it by memory, as well as kind of remembering objects that have been seen from prior experiences. A lot of times we assess this through discussion with the patient and their family members on how they're interacting in the world. And we often see these patients perhaps confusing those who look similar, such as a mother and the aunt, their siblings and similar features, and having difficulty kind of distinguishing those finer details to be able to tell them apart. We may also see that patients will use other indicators such as hair, posture, voice, or even clothing that one is wearing in order to identify someone rather than by their face. This can also be related to locations and the ability to map places, such as knowing where a room is in a house or mapping a route from one class to the next for those who are still in school. The ability to use vision in the setting of visual clutter or distractors. So oftentimes I use a few different testing to kind of assess this, including our CVI complexity cards. The cards are a series that have a main target, this one being a dog. And the cards get more and more complex with different images that may look similar or be similar colors to the dog, while that dog moves around as well. And we see how the patient does being able to find that dog as it moves around in all the images with all of the extra cognitive load. I also look at complexity with having the patients work on puzzles. And you can see there I have a very simple color with the Leia shapes and bright backgrounds, and it's very obvious where some of the colors should be going, versus some of our more difficult puzzles where, as we see here with the farm animal, there are less indicators for which image should go where. Movement is another aspect of CVI that I often look at, and this is the ability to kind of notice, follow, and accurately perceive objects that are moving. This includes the speed, the direction that things are moving, as well as the smoothness. Sometimes we hear from our patients with CVI that they're only able to notice objects whenever they're moving or whenever people are moving. Sometimes we have the opposite, and that movement actually makes the use of vision even worse. We also find with our patients with CVI have an increased awareness of peripheral motion and may prefer to view things from the side of their eye rather than directly on, due to that increased awareness of that motion. Our visual field is another area that can be impacted, and this is just simply that peripheral vision and awareness. Oftentimes we hear that those with cerebral visual impairment may have difficulties when there are others in the room, or they're in crowds, or even in new locations. Within the office, sometimes what I'll do is do our typical visual field measurements in a very quiet room. And then I'll repeat it again when the patient's engaged with a favorite TV show or toy, and kind of see what that usable visual field looks like whenever they're visually engaged with another task. We often hear that patients with CVI are more likely to notice objects often in that inferior field, and may use their sense of touch to explore the world and navigate. And you may see some toe tapping and feeling at thresholds rather than visually taking in that information. Visually guided movement, or which is more or less hand-eye coordination, as well as that awareness of object location and space. We test this sometimes in many different ways. So for some kids, I'm able to do the lay a post. I have a little yellow tab that the patient has to be able to get that white mail slot in at different orientations. For those that might be a little bit more tough, I use our simple shape shortening bucket as there, and I like to see how the patient does being able to figure out where the shapes go and be able to figure out the orientation, the shape, and the size. I'll also look at visually guided movement through stacking blocks. And oftentimes I'll have the blocks scattered around the table and encourage them to build a tower right in the center. And as I'm doing that, I like to see how precise are we as we're moving around the tower to grab some of the cubes? How accurate are we as we place the cubes on top? And kind of seeing how that works with their ability to have that hand-eye coordination. Outside of care with optometry ophthalmology, there's many other medical providers that I often work with, and this includes neurology and genetics. And oftentimes I'm reviewing the records from these other providers to see how they build in with both the neurological and visual profiles. Oftentimes I'm looking at MRIs or other neurologic imaging to kind of get an idea of perhaps what visual systems may be impacted as related to the anatomical connections. Educational assessments are also very important. Our teachers for students with visual impairments completing our functional vision evaluations, learning media assessments, and CVI assessments are often integral, both in kind of determining that diagnosis of CVI, as well as continuing to support the child after the diagnosis, both at school, home, and in their community environments. We also see orientation and mobility assessments, which are excellent and very helpful for those who have difficulties with their spatial orientation, as well as having notes from OT, PT, and even speech providers. Getting that full IEP or family service plan is very helpful to have an idea of where the child is globally, and we can have a sense of how we can approach the examination, as well as some areas that the family and team members might be wanting addressed as a part of our examination. Finally, I'd like to direct us to the CVI Now doctor directory, which recently came out and is linked here. And I encourage those who are needing a diagnosis or interested in seeking out care with someone who is familiar with CVI to go to the website and kind of see if there are providers nearby. Thank you so much.
Learn more about CVI at cvinow.org and learn more about developmental and epileptic encephalopathies at deepconnections.net.